in terms of Professor Cheng's advice to strengthen these mask rules for another day, did the government hesitate on that at all, or was the advice provided and the decision made?
Yeah, the advice was provided, Simon, and the appropriate thing is to respond and accept that advice, and that's why we're here before you today saying the public health advice is comfortable that the easing of restrictions that we talked through yesterday that come into effect 11:59 tonight, all of those will proceed. The public health advice is that they can, subject to one small adjustment, which is in regards to the wearing of face masks outdoors. And I've said a number of times, we don't have the luxury of picking and choosing the public health advice that we like or that we don't like and then not go ahead with elements of it. The clear advice from the public health team, from Professor Cheng, Professor Sutton, is that we need to continue with the wearing of masks outdoors. It's a little inconvenient, but it's an easy thing to do. We're used to it. We know that it works. And as we come out of this period of lockdown, whilst we're driving these new cases to ground, I think it's a logical and common sense step to take. And it allows all of the businesses that we've outlined yesterday that will open, they can all open. The movement of people, that can all happen. Students back at school, that can all happen. It's a small price to pay to make sure that we can proceed with this careful easing out of lockdown with the continuation of this restriction.
Can I just ask, how come all the states are quite different in their approaches, or at least there are big differences, when each government is taking medical advice from medical officers who all talk to each other, and each of the states agreed in National Cabinet to pursue the same target, the same thing? So how come there are differences?
Because the nature of each outbreak is different, Alan. There's national agreement in terms of aggressive suppression. There's national agreement in terms of infection prevention, protection controls that we have in hotel quarantine. So there are a number of things that we engage with and agree at a national level, but it's a reflection that every single outbreak is different. Now, we've had outbreaks here in Melbourne that have been particularly localised and contained, and therefore did not lead to a period of more broader lockdowns. But you look at this particular outbreak that we're dealing with, originated in a hotel breach in South Australia. It spread very widely. So the number of primary close contacts, hundreds and hundreds of exposure sites in regional Victoria and metropolitan Melbourne meant that the public health advice was that we needed to have broad settings in terms of a period of lockdown and in terms of restrictions. So every outbreak is different, and that's why the public health advice, whether it's in WA, New South Wales, South Australia, Queensland, here in Victoria, the public health advice is dealing with the situation on the ground, the variant of concern.
Are you saying that you would like to do localised lockdowns like New South Wales has been doing, but you can't because of...
No, that's absolutely not what I'm saying, Alan. I'm actually talking about outbreaks here in Melbourne. The Black Rock outbreak didn't lead to broader sets of settings of lockdowns because it was contained locally. So it depends on the situation that you find yourself. In this current outbreak, the breadth of exposure sites in regional Victoria, metropolitan Melbourne, the sheer number of primary close contacts, the appropriate advice from public health and accepted by government was that we needed a period of lockdown and then careful easing back of restrictions. In Black Rock, in Victoria, in other local outbreaks in Victoria, it hasn't led to that public health advice because it was contained in a small area, and we could run it to ground very quickly.